Here at the Palo Alto Medical Foundation, we are committed to enhancing the well-being of the residents of our communities through excellence, caring, and innovation in healthcare services, research, and education. We deliver outstanding medical care to our patients, and in each of our roles, we have the opportunity to enhance their experience as we support each other. The video you're about to see illustrates best practices for interacting with our patients, with their families, and with each other in providing an exceptional experience for every patient, every time.
Being prepared means checking the chart, knowing that the patient's appointment's at a particular time. Often, patients know they're going to be here at a particular time, but it would be nice for us to restate to them that, thank you, and it's nice to see that you're here.
You always want to be prepared for the patient needs, so constantly being in check with who's coming in, what they're coming in for.
We have patients that sit in the lobby that are just, literally exhausted of the whole process of feeling ill. What I really try to stress is that we be kind. We understand that they're here because they're not feeling well. It means a lot to them.
Good morning. How can I help you this morning?
Hi, my name is Leilani Stone, and I have an appointment with Dr. Besser today, and it's my first time.
Humanizing the patient and seeing the patient as a person, not a medical problem, is probably one of the most important things that we can offer here at PAMF.
Your first impression is really critical in the patient's eyes.
Thank you for coming to Palo Alto Medical Foundation, Ms. Stone.
Oh, it's okay. You can call me Leilani.
I think one of the most important things is just tell me who you are, tell me what your function is, and let me know that everything's okay and that I'm not going to be surprised at anything that you do.
Hi, nice to meet you. I'm Michelle, I'll be your medical assistant.
As physicians, we oftentimes see lots of patients in a day, so every time you go into that room, you need to make that connection and to really engage the patient in that introduction.
I try to remind myself every time I step into a room that this is a new family, they need my whole focus, and I'll actually pause right before I walk in that room and really kind of refocus before I step in.
Smiling and having eye contact and just making sure that you're really listening and your body language, your demeanor is in a positive manner.
Any concerns about Mary today?
She's 6 months old and I noticed she hasn't rolled over yet.
Having examined Mary today, I really can reassure you guys that she's developing beautifully and normally.
All of us know what it feels like not to be listened to. When you actively listen to the patient, it makes them feel valued and respected and part of the team themselves and not just a number in the waiting room waiting to be called.
There's times where you can see it in their eyes that they're hurting and they're in pain, and therefore we will take that extra time to understand the patient's feelings, needs, and wants.
I sit down, I don't stand up, I make sure that I'm not doing anything except focusing on them at that moment.
They continually communicate with me. When they're taking the blood pressure, they're listening, but then they say, okay, this is what your blood pressure was. I don't want to be left out of what they're thinking.
I always ask before I touch them, before I move them, before I do anything else, I always say, do you mind if I take your blood pressure today? Okay, which arm would you like me to use? It makes them feel like they're in charge of the situation. It makes them feel like you actually care about what they have to say.
Before we begin, is it okay to have this conversation in front of your wife?
Oh, yes. Coming in and making that introduction, not only with the patient, but making that formal introduction with everyone in the room, asking what their name is, what their role is in that patient visit, and then asking the patient specifically, are you okay if we talk freely with the individuals in the room? And if you're uncomfortable with anything along the way, please stop me and we can make some adjustments to that.
Your appointment is confirmed with Dr. Nauenberg on May 1st at 2 o'clock.
Sometimes we forget we do this 100 times in a week, but that patient only comes here once a year maybe and doesn't know what the routine is or doesn't understand. But I think it really is helpful. This is what we're going to do, and probably take us about 10 minutes, and then the doctor will be in to see you.
Do you have any questions for me?
Yes, should I be recording my blood pressure readings on a daily basis?
Yes.
I always have questions, or I'm going to have questions. Sometimes I'm not given the opportunity. There's not a break in the action or a break in the conversation to ask the questions. So I think what's important for the caregiver is to make sure that the patient has asked all their questions, and make sure that you do it before you walk out the door or before you tell the patient that it's okay to go.
Okay, do you have any concerns or questions?
The last thing we want to leave the patient, is there any other questions that you have? And what steps are going to happen next? Are they going to receive a telephone call back? Do they need to schedule another appointment? Can they get dressed and leave?
It was a pleasure and great serving you. Thank you.
Thank you.
You know, the old-fashioned thank you, that never goes out of style. It's something that I think gets lost in translation often because we make some assumptions about people needing to be here. But a simple thank you goes a long way. It really does.
Not only will you feel better at the end of the day for the job that you provided to our patients, you've really made a difference in their day, in their care that they received at Palo Alto Medical Foundation.
If you have an unhappy nurse or a medical assistant or front desk person, patients know it. So there's an expectation that that's how you behave towards everybody, not just to patients, but that's how you treat each other.
As a patient, great care makes me feel secure.
Patients should feel like we really care about them, from our front desk all the way back to the physician. Everybody really had a sincere belief that they were serving that patient's needs.
Palo Alto delivers exceptional patient care, and we're all working as a team together now to deliver that exceptional service to every patient, every time.